Hello, it's Dr. Shelley of HETV, and this video is not just for nurses, but it's for everyone. And so right now in the news, you hear about Epstein and P. Diddy and, Ghislaine Maxwell and all of this horrible stuff going on, and it seems as though America has reached the point where they're okay with a lot of it. And this is where I come in. My job here is to take current events like these people we see in the news, these famous people. You got the R. Kelly, the P. Diddy, even Michael Jackson possibly, right? You got your Epstein, who's now dead, who knows how, but he's dead. And then you have his recruiter, supposedly, Ghislaine Maxwell. You have other things in the news that you probably don't even know because it spent about 40 seconds in the news while they were making sure they spent 40 days or even weeks on other people, typically people of color. So everybody knows R. Kelly and P. Diddy. We all know about that, right? But did you know? Did you know that the ex-CEO of Abercrombie and Fitch used to be called Pimpercrombie and Bitch if you was back in the day like me in high school? Yeah, the ex-CEO, who by the way is 80 years old, the ex-CEO of Abercrombie and Fitch has been accused by more than 40 men of having been, having raped them as children, drugged them up. The name of this person that is allegedly guilty of all this stuff, but has been has got to go through trial and was charged in October of last year, because you didn't know that, did you? No, but you know about P. Diddy and you know about R. Kelly, but wonder why you don't know that the ex-CEO was charged with, supposedly, allegedly raping some boys back in the day in the 1990s. And he did this supposedly, allegedly, across 3 continents. Talk about trafficking. Yeah, I did. I said 3 continents. Yeah, that's not countries. Now, continents have a lot of countries in them. You'll get it later. Yeah, but what about some of the things in the past? You again are seeing Bill Cosby and people of color just kind of, and rightfully so, they are assholes. We know that they are just the worst. I personally, and everyone who knows me knows, I don't even listen to anything made by R. Kelly. And I'm in the process of making sure all playlists get rid of P. Diddy. But I just want to share how unfair the media is when they share information about molestation and trafficking. Let me help you with this. For example, your boy Elvis. Yeah, your boy Elvis, he married, met, slept with his girl when she was 14. Yeah, he was 24 and good old Priscilla Presley was 14 years old. You know how they do it in the South. Actually, it's anywhere. It's not just the South. But then, of course, there's somebody that outdid him. You may or may not remember this name because I'm old, so I remember. But anybody around my age will definitely remember the man, Jerry Lewis. Yeah, girl, Jerry Lewis. He was 22 and his girl that he slept with was 13. Now, she later divorced him and told about all the abuse and torture that she went through. But again, she was 13, but I bet you didn't know that. But you know about P. Diddy, R. Kelly, and Bill Cosby, right? And Bill Cosby's people were adults, but it was assault all the same, allegedly based on the fact that drugs and all this quaaludes and stuff was going on. But I'm just trying to help you understand the imbalance of the media, okay? All right, now, the Menendez brothers, I remember these kids. I do. I remember when it happened. I remember being as judgmental as anybody. These rich motherfuckers out in California, look what they did to their parents. Oh my God. Nobody really knew anything about the abuse, anything we thought we knew about the abuse. We thought it was just some old perp story from them because they wanted some excuse to kill. Come find out that shit was real and it started at 6 years old. Kind of like R. Kelly's rapes, the rapes he endured as a child started at 6 years old too. So you got the Menendez brothers rapes from their dad starting at 6 years old, alleged. You have the alleged rapes of R. Kelly starting at 6 years old. I think it's time we took a look at child molestation and sex trafficking. So that's why I'm here. And I hope and pray you can subscribe and really listen to what I have to share with you, most of which I'm sure half of us don't know. So let's get started. First of all, whether it's child molestation or sex trafficking, it is coming from a place of power. In particular, what we're talking about from a place of power is that whoever is the victim, the person that did this to them held power over them. That's common sense. In fact, we see like this interaction about power and the effects of power on three issues, whether it's intimate partner violence, we used to call it domestic violence, right? That's a power issue. Sexual assault is a power issue. And then, of course, trafficking is definitely a power issue. So it isn't about sex, it's about power. And that's important to remember, because if it was about sex, go find somebody your own age and y'all get it together and do your thing, okay? Voluntarily. Now, so let's move on. When we look at child molestation, and this is so important to understand the ins and outs of child molestation because it is so prevalent. Most of us in our families have been touched by this. Most of us have a creepy uncle fill in the blank. Most of us have that family member that you don't want to be in the room alone with. You don't want to be on their lap. I mean, it's that prevalent, right? But that does not negate the need to educate everyone and to make sure everyone understands this is a crime against children, for crying out loud. And as I so eloquently stated, these children will go on to commit crimes against other children. Again, you're talking about the Menendez brothers literally murdering the parents and having had as a possible contributor to that insane mindset that causes you to kill your parents, rape since 6 years of age. You have R. Kelly with the craziness. We all saw it on TV. His rape started at 6 years old. Everyone remembers Antoine Fisher, the fictional movie Precious. I mean, I could go on and on. Oprah Winfrey and her focus and spotlight on this issue, but yet this is still happening quite a bit, and I almost feel like it's celebrated and even illuminated in pornography. If you look at pornography and different pornographic sites, you will find that they're always talking about the stepdaughter this and the niece that and the, oh, uncle did this to me and my daddy came in my room and all this nonsense. So there's a culture that is responsible for what we're seeing. And what are we seeing when it comes to sexual molestation? Well, we are seeing that 1 in 3 girls and 1 in 5 boys are molested in this country. I'll say it again because it's crazy and I believe it because I know these people. 1 in 3 girls, 1 in 5 boys. Now, out of all those children being molested, 90% of them knew and trusted their abuser. That's critical to remember. These kids knew this person. They trusted it. It's less than 10% are stranger danger, rapists, molesters, whatever. Less than 10%. Okay? So the problem when we look at 1 in 3 girls are abused and 1 in 3 boys are abused, sexually molested, is that we got to remember who's doing the abusing. Ah, yes, 1 in 7 are doing the molesting or the abusing or whatever terminology you want to use. And that right there is why we're here, because this tends to be generational and repetitive. So we need to remember that when we look at the incidents of child molestation and the fact that 40% of these molestations are done by a family member, we also have to remember that 40% are done by a child on another child. And I know very close to home some of these situations that have happened in friends and family that I absolutely love. So that's why I am here. We have got to get more aware of what's happening. This whole 40% of child on child, 13-year-old boy to a 2-year-old girl, 14-year-old boy to a 6-year-old boy. I mean, these are real cases I hear about. And sometimes I'm teaching my class and I'll say something, and that parent, that student who's sitting in my class, who's actually a parent, will come up to me and confide in me that, I don't know, Dr. Shelley, but my kid's doing some of this stuff that you talked about. I'm going to go see what could be going on. I don't know, Dr. Shelley, but you know how you were talking about this, that, and the other? I got a little niece that acts like that and does that. I'm going to see what's going on. Do you know how I should approach it? This is real. None of us want kids abused, I would hope. But yet there is a certain kind of acceptability to some of this. So we need to stop it, okay? So let's go ahead and look at some more stuff. First of all, the biggest issue, which is not technically the biggest issue with trafficking, the biggest issue with child molestation, and I gotta get you there with me, is opportunity and access. There is repeated opportunities for this person to abuse these children. There is open access to these children. So opportunity and access, you're going to hear me say that a lot. That's what we've got to focus on in terms of prevention. Opportunity, access, okay? Now, I want to tell you something that you may not know. Alcoholism is a huge risk, a big, huge risk for who tends to abuse children sexually. Yeah, I said it, alcoholism. So drunk Uncle Joe or drunk Aunt Mamie, because I don't want you to get too focused on men, although 90% of child molesters are men and they are single, but I don't want you to just get so tunnel vision you forget the women. Remember Antoine Fisher and R. Kelly, allegedly, raped by women. Okay, so I want you to remember that this whole alcoholism plays a major role, so that you look at it a little bit more strategically when you're taking your children somewhere or you're leaving them somewhere for an overnight stay, which I never really believed in because so much be going on nowadays. You know what I mean? Okay, now there is, when you're talking about child molestation, our biggest problem here is that there's no witness. And guess what, guys? There is less than 3% physical evidence. In other words, I mean, if you tried to take this kiddo to the ER and get a sex kit where you look at, see if you can get bodily fluids and all the rest, it's really difficult. It's extremely difficult. It's one person's word against the other. And of course, we should always believe children. But again, it's difficult, right? So we have that issue. Here's the saddest thing ever, and this is where you come in, healthcare providers. The saddest thing ever is 100%, did you hear me? 100% of children feel guilty, they feel bad, they blame themselves for the entire event. And, you know, it doesn't matter if it was one time only or repetitive, they feel guilty, they feel bad, they feel like they were at fault, they blame themselves, and it does not matter the age of the child. It does not. And so it's hard to tell another person that this is going on. And depending on what they say, this could get very profoundly worse and obviously have long-term implications in the future in terms of relationships and everything else. Here's another deal. Children under the age of 5 very often give you the disclosure of this child molestation in the way they play with their toys or the way they interact with each other. So when a child is taking 2 Barbie dolls and slapping them up against each other and saying very awful things like suck my dick and whatever else, and please know that that was for the video and your educational purpose. So suck my, you know what? I mean, this is because this is what is being told to them. 5-year-olds don't take Barbie dolls and make them, quote unquote, you know, F each other and suck each other and finger each other and all this nonsense. So any kind of action that is inappropriate for that age, any type of sexual interaction or sexual action that's completely inappropriate for that age, yeah, you know, this is a problem, because this is telling you that this child is seeing and hearing and maybe experiencing these things, and you can't possibly tell me that someone under 5 should be. So either way you go, whether it's just a movie they saw, it's inappropriate. It's crazy, right? So just common sense. Be aware of grooming. Grooming is where the abuser is very nice to the child, very kind, very loving, takes an interest, knows all about them, understands what they like to play with, what they like to do. Maybe it's gaming, maybe they talk their language when it comes to Fortnite, or maybe it's social media. They're friends on social media, so they're, you know, they're really buddy. But then more importantly, they're not just grooming this child to trust and indeed like them. They're grooming the parents. They help the parents. They buy school supplies for this kid. They take this child on field trips. They do things with this kid. It's not just that they're coach. No, it's not just that they're the teacher. No, they're taking an extra interest in this child. And they make sure, these people make sure they're always in the presence of children. And you've heard some of this. You've seen the gymnastics doctor. You've seen the coaches at Ohio State. You've seen different things where you're like, whoa, teachers especially, right? You hear about it on the news in the morning, and you know, your local news or whatever. So grooming is a very critical aspect of this child molester, building trust, getting this child to even maybe like what they feel. This is the other thing. And so now the child feels guilty all over again, because why did they like that? You know, you see, it's crazy. Okay. It's really just brainwashing our babies. Now, what type of signs and symptoms might a child show us that should make us at least suspect maybe something's going on? And I've never been sorry that I teach this. I've never been sorry that I suspect children of being abused when I see these signs and symptoms. I can even tell you that I have yet to see these signs and symptoms and report it or express my concern. I have yet to be wrong. So I feel good about what I'm sharing with you right now about the signs and symptoms of children who may be enduring abuse, sexual abuse. Here we go. Somatization, soma, body, tization, right? Somatization. Somatization or somatization means that this child is going to complain about parts of their body, soma, body, parts of their body hurting. And it's not the part you're thinking. No, they're not going to say my vagina hurts. No. No, they're going to complain of headaches. They're going to complain that their stomach hurts. They feel sick to their stomach. They don't feel good. Something hurts. Their head, their stomach are the two most common things that hurts. And they may not want to go to school if this offender is at school. And so they may even be sicker. The issue is this stuff really kind of hurts, because when you're stressed and you don't feel good and you're worried about every little thing and you're scared, oh yeah, your head and your stomach might hurt, right? You know that. So somatization. Unfortunately, we see frequent urinary tract infections in girls, especially young girls, but also older girls, because we know that frequent intercourse we used to call it honeymoon cystitis. I'm an OBGYN nurse midwife from back in the day, retired now, but still I have patients that I would call it honeymoon cystitis, frequent acts of intercourse, like some of these children that are trafficked or some of these children that are molested, raped, whatever, by their family members or friends that were trusted. They will have frequent bladder infections, urinary tract infections, because we know that some of these acts of intercourse might be anally or vaginally, and those two body parts are right by each other. Now we see it more in girls, but what happens is the E. coli, and this is for my nurses, the E. coli, just think colon. E. coli causes a lot of bladder infections. Well, E. coli is normal in the colon, but it's not normal in the vagina. And when you are molesting or trafficking or doing any number of things that are going on with these kids, you know, the penis may go in the anus and then it goes back in the vagina and then back and forth, and just causing all kinds of horrible things to happen, because right by the anus, the vagina, right above that is the urethra, and all of those holes or orifices are right by each other. So infection goes everywhere, right? So this is why frequent UTIs in a young girl, especially a very young girl or even a teenager, but especially a young girl, should raise red flags. It's not normal. Once you get the first UTI, okay, that's reasonable. You teach the wipe from front to back, mommy and possibly daddy, you know, there's nothing wrong with that. Mommy and daddy make sure this child has good hygiene, whatever. But this is what we see. I'm just telling you, I know for a fact this is what we see. Frequent sexually transmitted infections. Now that's a red flag anyway, but I have even maybe just judged some things wrong in my career. I remember being one of those OBGYNs that I keep getting this 16 or 15-year-old with chlamydia and trick. And I'm like, well, how many times you gonna come up in here, little baby, this year with this mess? This is going to hurt you. This is not good. This is crazy. And I don't know that my mind went to trafficking or sexual molestation, but it probably should have, with those patients who might have come in 3, 4, 5 times a year with this. And so we need to do a better job of understanding that that teenager who can't let go of that boyfriend who keeps getting her infected, that might be actually the teenager who has been trafficked and has to have sex 20 to 30 times a day, or being molested by that uncle who has a sexually transmitted infection and does not get it treated and may not even know it, because so many sexually transmitted infections are, you guessed it, asymptomatic in both men and women. It's a misconception to think that a sexually transmitted infection, STD, VD, we used to call it, that you will feel symptoms. Sometimes you do, but 99.99% of the time you won't. Okay? So another sign of possible sexual molestation, and this is definitely focused on sexual molestation, is bedwetting in children that are over 5 years old. This is the discussion that absolutely needs to take place with the pediatrician. Talk to your pediatrician as to what in the world is going on. See if there is a way to figure out what is happening. Is it simple regression because you just had a baby? Or is it diabetes, type 1 diabetes? It needs to be worked up. We can't assume it's just a phase. No, it could be, if it's not diabetes, if it's not the fact that you are having another baby or brought a baby home, if it's not any of those things, it could truly be that these children are being sexually molested. I mentioned this in the classroom once, and well, I mention it all the time in the classroom, and someone came up to me and said that I think he was like 10 at the time, their 10 or 11-year-old son is having this issue, and they were like, what is going on? And they had kind of they had kind of recently moved back home with their mom, and that was thunder, by the way. I didn't like that. That's what made me go, whoa. But anyway, they had moved back home with mom, and with mom was their younger stepbrother or brother who was 14, and then there was this precious child of this student, and that child was 10 or 11, and he kept wetting the bed because he was scared to death to go to the bathroom, because every time he went to the bathroom, this older sibling of this mother, this 14, 15-year-old kid sibling, was literally raping this child in his anus, and it just, you know, awful. So that's the bedwetting after 5 years old. It needs to be investigated. These children have very little eye contact. They're very submissive. They may feel some kind of way, not excited, not happy, not thrilled, kind of like lukewarm about seeing the person that's actually abusing them, and you don't recognize it. I remember seeing a case study like this, that the 2-year-old would scream bloody murder, that they don't want to go over to this person's house, and they would just be screaming, and it was really out of character. 2.5, 3-year-old just, I don't want to go, you know. And here it was because this 13-year-old over there was molesting this 2.5, 3-year-old, and they didn't have the words to put that in a sentence, right? We're 2.5, 3 years old. How do you put that in a sentence, right? So they're just acting out of character, right? Or maybe they're super clingy the minute you get to that house, or the minute you get to that area, that place where that person is. They don't want to leave your side. They're super clingy. Those are all signs sometimes. It could just be normal, but you just kind of want to pay attention to things we may not be looking at. Here's a big one, and I would like to thank teachers who told me this one. There are many teachers that come through my program to be a nurse, and I had a 3rd grade teacher tell me this, I had a 2nd grade teacher tell me this, and I had a kindergartner teacher tell me this, and it broke my heart all 3 separate times, 3 different contexts, right? We weren't even talking about the same thing. And they said that the big one is stool incontinence in children who should have complete control of their bowels, right? So they either get teased in school about smelling like poop, or they are literally losing their stool in their clothing, and maybe they need help wiping or whatever. And the reason for that is that constant anal rectal abuse, sexual rape in the anal rectal area can damage your sphincter. It can damage the muscles. It can damage all of that in a child and make it very difficult to hold your stool. I mean, it's crazy. Not to mention so many different lubricants and products that may be used with this act of molestation. And I'm sorry, but I have to be very, very, transparent and talk about the way this is, because if I don't, how will you ever know? So, you may be grossed out by some of this, but this is real talk for real children being really abused. Okay? There may be weird bruises, and I want you to especially understand this, even with the trafficking victim. I want you to make sure that if you see bruises on anybody, really, but especially teenagers and children around the neck, it's a big deal, because we know that strangulation of any sort can be part of the sex act. And we also know that strangulation can be part of intimate partner violence. And here's what makes it so bad, totally, with intimate partner violence. If someone will reach out to strangle you, you have a huge 10 times higher risk of being killed by that same person. So the whole bruises around the neck, ligature marks, handprints, any of that around these kids is crazy. So this type of bruising is highly suspicious of what is going on here, okay? Bruising in the inner thighs, excoriation, soreness, raw, red, all of that. I know someone personally who said they don't remember when it started. They don't remember being a virgin. They don't remember how young they were when the abuse started. They just remember some very clear memories of their grandmother putting what we used to call back in the day salve, which is called in this day ointment, in between their thighs and around their vagina, like, you know, A&D ointment or salve, we used to call it, in between those the crevices of the vagina, the labia majora, all of that. That is crazy. And she remembers that at 3. You don't wear diapers at 3. You don't have diaper rash at 3. What the hell was that about? Okay? And this just horrible. Like, what is going on? And this grandmother just kind of, you know, carried on life, right? We have a situation where this bruising that you may see may be in different stages of healing. You know that's a sign of child abuse anyway, but it may be just so repetitive. It's on their butt, it's on the inner thighs, it's around the neck. It's like this repetitive abuse. Okay, so it's like one area there's blue bruising and some look kind of reddish purple, and then others, depending on what color the patient is, may be yellowish. Yeah, I mean, it's crazy. I've seen it all. Frequent absences or tardiness to school. In and of itself, who cares? But frequent absences is a big thing for intimate partner violence, which we call domestic violence, sexual assault, for sure, trafficking. So frequent absences and tardiness at school. Here's one that I noticed in people that I know have been through this torture as children. Highly sexualized behavior, right? So they're quite sexualized for their age. They are doing lap dances on uncle at 4. What? They are doing this kind of nonsense at 3. What? They are just doing way too much for their age. You know what that means. You know that they have either seen too much, which is kind of like abusive, or they've literally been through too much. It's crazy. And as these children get older, their sexualized behavior goes up as well. And so they may be the child that is trying to do the PU, whatever, you know, the nasty, we used to call it, trying to do the nasty or playing house with their cousins. And they may be taking it to a whole nother level using, you know, you just got to be aware that this highly sexualized behavior might be a sign that this poor child at 8 years old or 7, because I remember some of the ages of these kids, 7 and 8 year olds being that sexualized, knowing different sex acts at that age. Why, Jesus? Right? Like what? Okay. All right. Now, this is very generational. It is not uncommon that a couple family members get together and confide and say how Uncle so-and-so did this to them, and then you find out that this sorry bastard did it to everybody in the family, or that he raped all of them girls over there, or he used to mess with them boys over there when they came over. You know, you just hear this and you're just like, well, how was anybody cool with any of this? And people just, well, stay away from Uncle. You know he got issues, and don't leave her at home with him. He might do something to her child. You know how he is. I mean, just crazy, right? And then we're okay with that. This is a crime. Let's just be real. And it's very difficult because depending on who the family member is and who's covering for them and who doesn't want to report them and press charges against them, and family mess and craziness, it can be really, really bad. Okay, now that was child molestation. I'm going to make another video dealing just with trafficking, but I put them side by side because they're so interrelated. How are they interrelated? Well, the number one risk factor for sex trafficking is prior history of sexual abuse or neglect. That's just real. Okay, so what as a healthcare professional is our responsibility? Well, first of all, I want to share a couple things. One is that remember Ohio law, right? The age of consent in Ohio is actually 16, but not for anything that's forced. So remember that rule. Forced sex, I don't care how old you are, is a crime. But the age of consensual sex between a teenager and another teenager of that age or within 2 years of that age is 16. Okay. Has nothing to do with sexual molestation or trafficking, but we have to know the law in Ohio. You should know your state law as well if you're not from Ohio. Now, I pointed Ohio law out for a couple reasons. Believe it or not, there are some choice cities in Ohio that are known as the trafficking center for the country. Toledo, Lorain, even Cleveland. Why, you might be thinking? Well, we're right by that body of water. And once you get in that body of water, it's real hard to track and police you. Okay, and then just right across, real close, is another whole country. So it's crazy. All right, so we got problems. They could put you on the water and be on the water for a while. All right. I want you to remember that the United States, when we look worldwide, it's the United States that's the #1 consumer of child sex. Yeah, just they buy it, okay? Whether it's child pornography or the child themselves, all this nonsense. We're helping the industry, okay? All right? Porn tends to normalize this crazy interaction between an uncle and a niece, or a stepfather and a stepdaughter, or all this nonsense, just making it seem like it's cool. I mean, for crying out loud, the lawyer, Alan Dershowitz, the lawyer for Epstein, and who is this? Ghislaine Maxwell, who might be getting away with all of this stuff because the orange guy up in the White House is, helping her out a little bit, it seems, allegedly helping her out with giving her a way to say that all of the client list was made up by Obama. He loves some Obama. What is going on with him and Obama? My God. If he could just get Obama out of his brain, it might help him. But, he blamed Obama for getting this client list together. And now Ghislaine Maxwell, who's going through her court case, might just have a reason to drop that case and dismiss the whole thing. And that's all deliberate. That's why we're here, right? Okay, so Alan Dershowitz, who was the lawyer for both of them, he actually put in print that it needs to be looked at, this whole age consent. Allegedly, he put in print, now look it up, don't trust me, that maybe the age of consent should be, looked at more like puberty, like around puberty and up. Puberty for girls is 12, you fool. Oh my God, like what? There is some train of thought out there by fathers, uncles, grandpas, stepdads, that it should be a fatherly figure to be the first for this girl to break her virginity, because we're going to be much more gentle and we love her. I'm telling you what's going on in people's heads, that this is okay. Okay, here's another thought. You and I know this. Certain cultures, it's not that big a deal to get married at 13. Well, that's not this culture, okay? So just cut it out. Jesus. Okay? Now, back to what you should do as a healthcare provider. So I did all that for the typical lay person, anybody who wanted to know anything about child molestation. What, though, should a healthcare provider know? Well, number one, we need to interview these children or interview these teenagers by themselves if we can, if it makes sense. Sometimes it doesn't. My favorite way to do this was to tell the child, I need a urine specimen, and I'm going to show you just the way I have to have it, because it has to be kept very clean. And I'm going to help you as you do it. So my pregnant patients, all of them, if they were pregnant and teenagers and I thought something was shady, or if they were just teenagers and they kept coming back and forth with these different things, I'm going to show you how to get a very clean specimen, because I want to make sure you don't have a bladder infection. When I get behind that bathroom door, that's when I start talking to them real quietly about, are you okay? Okay. Now, we have to understand as providers, mandatory reporting is the law for any suspicion of abuse of any kind in children under 18, or in Ohio, anyone under 21 that might have a developmental handicap. We need to consider whether we should call the sexual abuse nurse examiner. It might help, won't hurt in a lot of these acute situations that just took place. This nurse is going to get some of those bodily fluids that would stand up in court, and the chain of custody will be maintained, and that's the proper thing to do, okay? Consider, of course, notifying our social workers. This is always an integral part anytime we're talking about families and anything to do with a child in a family. Or even the caseworker, because we know a lot of the sex trafficking actually is related to some of the foster parents. We'll talk later. Consider notifying the local police, especially regarding trafficking. Can't say it enough. Maybe it's not you that's notifying the police. Maybe it's a charge nurse or supervisor or some higher power, but that is actually a really important detail that I don't know that I knew as a nurse all these years, because I was like Child Protective Services, but the local police department, when it comes to trafficking, wants to know. Number 6, find a way, if you can, given the situation with children feeling 100% of the time that they're guilty and at fault, make sure you tell them, I believe you, and make sure you literally say the words out of your mouth. Please remember that none of this was your fault. You didn't deserve any of it, and there was nothing you did to make this okay. This was not your fault. You say that, you just over and over again. And then, of course, photograph and document everything and all things that you can. Now, I don't know. I hope you got something out of this. This was, basically a focus on sexual molestation. I do want to share just the phone number for trafficking, or probably if you call this number, you could get anybody for anything. But it's 1-888-373-7888. Text "be free" to that number. That's the National Trafficking Hotline. Yeah, so I hope it helps. I'll be back with part 2. This is just part 1. Thank you. Deuces.